Hello, we want to tell you about the planning of our conference. Hey guys, have been thinking how about we organize a conference on the future of personalized medicine and its impact on global health? This topic is incredibly relevant and I think it could attract a large audience. What do you all think?
I completely agree. Personalized medicine is revolutionizing how we treat patients, and I feel that having a conference on this could really draw in experts and healthcare professionals. We should definitely event some leading specialists in this field, maybe even someone who has worked in clinical trials or generic research. What do you think about that?
That's a great idea. I think it will be interesting to include a segment where people can learn about real cases and how the personalized medicine has changed and the treatment for certain patients. For example, we could have testimonials from doctors and patients or interactive sessions on how specific treatments are designed and based on a person's genetic profile. Does anyone have any ideas? Who we could contact for that?
Yes, I know of a few clinics and hospitals that might be interested in sharing their experience in personalized medicine. This will not only engage the audience, but also give these institutions valuable exposure. I can reach out to them if everyone agrees.
I think it's a fantastic idea. However, we need to ensure that the information presented is well documented and backed by a census. I guess we should have a plan to review the content of the presentation before the events. What do you all think?
That's a good point. We could organize per event meetings with the speakers to ensure that their presentation align with the conference goals. Speaking of which, I think we'll need a go-stage team to handle audiovisual equipment and live streaming. Does any join have contacts in that area?
Yes, I know a company that specializes in audiovisual setup for conference. They handle similar events before, so they understand the importance of everything running smoothly. I get in touch with them. By the way, I think it would be beneficial to have a keynote speaker who's being involved who really draws in the crowd. Maybe someone who's been involved in developing personalized therapies.
Absolutely. I've heard about Dr. Gomez, a leading researcher in personalized medicine. Gives incredible talks. It might be difficult to get her, but I could try to contact her. I'll see if she's available. But if she can attend in person, maybe we could arrange a live video session.
That sounds good. I'm also thinking that we could have a roundtable discussions after the keynote where several experts debate the potential impacts of personalized medicine in different areas of healthcare, like cancer treatment, chronic disease, and prevention. This could spark a lively discussions among the attendees. What do you think about the roundtable format?
I agree that a round table could be very interesting. However, I will learn that these sessions sometimes run too long, if not well moderated. We'll need someone who can keep the conversation on track and ensure that all present. panelists have their turn to speak. I know I feel moderator who specialist in healthcare conference. Shall I contact them?
Definitely, having a good moderator is key. I also hope we can incorporate some networking session where attendees can interact with the speakers and with each other. It's important to give people the opportunity to make connection, especially in a field as innovator as personalized medicine. How do you feel about that?
Networking is crucial, especially for healthcare professionals looking to collaborate on research or implement new therapies in their practices. I suppose we could set up a dedicated networking space, maybe with some refreshment. We could also encourage biotech startups and pharmaceutical companies to have both during this time. Do you think that will work?
Yes, that would add a lot of value. I think we should also consider the layout of the space and the flow of people between the conference hall and the exhibit area, and the networking space should be smooth. We don't want bottlenecks or confusion. I can work on a work floor plan and maybe even organize a site visit if it's necessary.
Good idea. I've noticed that well organized space contribute to the overall experience. I suppose we'll also need signage and maybe even a digital map accessible via a mobile app. I can research option for app development. We could offer attendance and easy way to navigate the event and receive notification about sessions they are interested in.
I love that idea. Having a movie app will really bring our conference into the digital world, aligning with the theme of personalized medicine. I started researching some user-friendly platform that could host our app. Mainly, we should also talk about marketing. How do you will get the word or to ensure we have a full house?
Marketing is essential. I think we should create a comprehensive plan that includes social media, email campaigns, and maybe even collaboration with health blog and podcast. We could also create a promotional video. All I think the key aspect of the conference, I can start drafting some ideas for this. How does that sound?
That sounds perfect. I learned that partnership with influencers in the health field can also expand our reach. Maybe we could get a few of them to promote our events. I'll start reaching out to some who align with our them.
That could be very effective. We shouldn't forget that we can also partner with health organizations and hospitals. They might be interested in attending or promoting the event on their networks. We could really have an impact on how personalized medicine is perceived and its application in global health. I am excited to see how all of this comes together.